Your toothbrush is one of the most used objects in your home. You use it every morning, every night, and probably never think much about it afterward. But while most people remember to replace things like razors or sponges, toothbrushes often get ignored far longer than they should. And that raises a surprisingly important question. How long is a toothbrush actually supposed to last? Does it stop cleaning properly after a certain point? And what really happens to those bristles over time? Today we're taking a closer look at one of the simplest everyday objects we own, right here, on History of Simple Things. People have been cleaning their teeth for thousands of years using chew sticks, cloth, and other simple tools. The earliest toothbrushes, similar to modern ones, appeared in China, using animal hair bristles attached to bamboo or bone handles. Modern toothbrushes became widespread in the 20th century after nylon bristles were introduced in the 1930s, replacing animal hair with something more durable and hygienic. Despite all the changes over time, the goal has always stayed the same: keeping teeth clean and preventing plaque buildup. At first glance, toothbrushes seem incredibly durable. They're just plastic handles with bristles attached to them. So naturally, many people keep using the same one for far longer than they probably should. But toothbrush bristles are actually designed with a very specific purpose. They need to be flexible enough to reach small spaces between teeth while still being firm enough to remove plaque and food debris. When a toothbrush is new, the bristles stand upright and maintain their shape. Over time, though, repeated brushing slowly bends and weakens them. Eventually, they begin spreading outward, flattening, or fraying. And here's the important part. Once the bristles lose their shape, the toothbrush becomes much less effective at cleaning your teeth. The strange thing is that this change happens gradually enough that most people barely notice it. Imagine trying to sweep your floor using a broom whose bristles are bent sideways. Technically, it still works, but it no longer cleans properly. That's essentially what happens with an old toothbrush. Plaque is surprisingly stubborn. It constantly forms on the surface of your teeth and especially around the gums. If it isn't removed effectively, it can harden into tartar, which can only be removed professionally. Healthy toothbrush bristles are designed to disrupt that plaque before it becomes a problem. But once the bristles become worn, they stop reaching tiny crevices as effectively. Ironically, many people respond by brushing harder. But aggressive brushing usually makes things worse. It wears out the toothbrush faster and can even irritate the gums over time. And that leads us to the big question most people are really wondering about. So how often should you replace it? Most dentists recommend replacing your toothbrush every 3 to 4 months. That guideline applies to both manual toothbrushes and electric toothbrush heads. For some people, though, replacement may need to happen sooner. If the bristles already look frayed, flattened, or bent outward, the toothbrush has likely lost much of its effectiveness. Children also tend to wear out toothbrushes faster because they brush more roughly or chew on the bristles. And many dentists recommend replacing your toothbrush after recovering from illnesses like the flu, strep throat, or severe colds. While reinfection risks are debated, replacing it afterward is considered a reasonable precaution. In other words, the condition of the bristles matters more than the calendar itself. This is the part that tends to make people uncomfortable. Your toothbrush is not sterile. Every time you brush, microorganisms from your mouth transfer onto the bristles. And because toothbrushes are usually stored in damp bathrooms, moisture can allow some microbes to survive longer. But it's important not to panic over this. Your mouth already contains billions of bacteria naturally. A toothbrush being exposed to bacteria is unavoidable. The bigger issue is usually poor storage habits rather than the bacteria themselves. For example, keeping a toothbrush constantly trapped inside a closed container can prevent it from drying properly. Dentists generally recommend rinsing it thoroughly and allowing it to air dry upright after use. And yes, there's also the infamous toilet issue. Studies have shown that flushing can spread microscopic particles into the air, especially if the toilet lid is left open. Those particles may settle onto nearby bathroom surfaces, including toothbrushes. It sounds alarming, but proper storage and regular replacement greatly reduce the concern. Electric toothbrushes have become increasingly common over the past few decades. Many studies suggest they remove plaque more effectively than manual brushes when used correctly. But despite their advanced technology, the brush heads still wear out just like regular toothbrushes. Some electric toothbrush heads even include colored indicator bristles that slowly fade over time to remind users when replacement is needed. And although the motor handles most of the brushing motion, worn bristles still reduce cleaning performance significantly. So even with electric toothbrushes, the same basic rule applies. Once the bristles lose their shape, it's time for a replacement. One reason people keep toothbrushes too long is because they don't seem broken. Unlike a dead battery or a cracked screen, a toothbrush continues functioning even as its effectiveness slowly declines. Since the change is gradual, most people simply adapt to it without noticing. There's also something psychological about familiar objects. If a toothbrush still feels usable, replacing it can seem unnecessary. But many people immediately notice the difference when switching to a fresh toothbrush. New bristles feel cleaner, firmer, and more precise against the teeth and gums. It's one of those small household habits that seems insignificant day to day, but over years of use, it can make a meaningful difference in oral health. A toothbrush may be one of the simplest objects we own, but it plays an important role in long-term health. Poor oral hygiene doesn't just affect teeth. Gum disease has been linked to inflammation and other broader health concerns throughout the body. While brushing alone isn't a perfect defense against dental problems, using an effective toothbrush consistently is one of the easiest preventive habits available. And when you think about it, replacing a toothbrush every few months is a surprisingly small investment for something used twice a day, every single day. So the next time you look at your toothbrush sitting beside the sink, take a closer look at the bristles. If they're flattened, bent, or fraying outward, they're probably telling you something. Your toothbrush may not last forever nearly as long as you think. Thank you for joining us on this journey through the history of simple things. Don't forget to like, subscribe, and stay tuned for more stories woven through the smallest details.